Meanwhile, concerns are intensifying in D.C. over Mayor Muriel Bowser's 2026 budget proposal. Today, the big issue is health care and the possible impact on tens of thousands of mainly low-income residents. During a public hearing before the D.C. Council, changes to health care programs were discussed. Our Matthew Torres is outside the Wilson building, where you heard from people who are really worried about their benefits. Matthew?
Simone, it's been more than a week since the mayor's office announced piecing away from DC's Medicaid and other health care plans. City officials say with the lack of revenue, this will help keep what they're calling a sound budget. But critics argue otherwise.
But now this impact will be detrimental.
Farigamina Tumpe advocates for social and economic justice, not just for others, but for herself.
Because right now, I even have to choose between whether or not I buy my medications or put food on my table. And I work.
This native Washingtonian is a Medicaid recipient. She joined other community members at this public hearing on health to speak out against Mayor Muriel Bowser's budget proposal to downsize DC's Medicaid program for many people.
They should not be cut, gutted, or changed in any way.
City officials say Medicaid costs are expected to grow by $182 million, outpacing revenue. 25,000 adults with no children and adult caregivers who earn more than 138% of the federal poverty level could lose Medicaid coverage.
When you have such cost inflation, the most pragmatic way to control costs in an entitlement program is to slow spending by reducing the number of people in the program.
Those affected could switch to other new health care plans under the city with similar benefits, although they may find themselves paying for premiums.
I think that the system needs a lot more adjustment before they can just come in and say, hey, we think this system will work for DC better than Medicaid's been working.
The budget proposal is also calling for big changes to the DC Healthcare Alliance, a program for low-income people who don't qualify for Medicaid or Medicare. It would phase adults 21 and older out of the program and impose new limits, including more frequent re-enrollment requirements. In this same public hearing, those against this aren't just critical, they're scared.
I won't be able to pay for my medicine or see my doctors. Please think about people like me in this community.
Mayor Muriel Bowser says with less money coming in, they must make tough decisions, but also prioritize economic growth to avoid cuts in the future. DC Council will have to consider these proposals in what's expected to be a weeks-long process. Simone?
As we just heard, Matthew, you did a good job highlighting there's a lot of people very, very worried. They're scared, and there's a lot of uncertainty around this. I know you'll keep us updated. Thank you.